A key concept here at ClinicHQ is the idea to pre-do everything that you can do before the client hits your parking lot. For some clinics, this can represent a big change in your current flow. Let's begin with discussing why we recommend this approach. Check-in is not only the most stressful part of your day, it's also the only part of your day where your patients, staff, and owners are exposed to the following risks. We call these the Big 7 check-in risks. Dog-to-human bites, dog-to-dog bites, loose cats attacking owners as they try to hold them, dog and cat flights, meaning the animal gets loose from the owners in your parking lot or lobby, dogs that are tied inside the back of a pickup truck, causing harm to themselves if they jump over the side of the truck, the spread of parvo, which can live in the soil for months or on lobby floors that are not disinfected daily, and the spread of distemper from dogs that are nose to nose or in close proximity, such as in an enclosed lobby. So a key strategy then would be to seek to minimize the risks associated with check-in. And a tactic of that strategy is to have all the time-consuming parts of check-in done before the client arrives in your parking lot. Here are the things that can and should be done before check-in. Number 1, collect client data. This data is collected when an appointment is made either online or internally. In other words, clients should not be filling out paperwork by hand at check-in. Number 2, pre-sign the consent form, whether this is before surgery or for a vaccine clinic. Number 3, predefining services that each patient will be getting for the day. Confirmation of those services and slight editing can be done at check-in, but there should already be some indication of what services the patient will be getting in addition to their spay and neuter. Number 4, prepay for the appointment. This can be done using ClinicHQ's e-payment link. An alternative to this would be to send the e-payment link after the animal is out of surgery, but before the client picks up. In other words, payment is super time-consuming and should not be done at check-in. Pre-printing a cage card, writing out dog neck collars, and pre-writing masking tape for cat carriers and cat heads. Number 6, each pet should get sedation at the moment they come into the clinic. For example, the ASPCA Spay-Neuter Alliance's drug protocols include administering acepromazine and hydromorphone at the moment that they come into the lobby, right after being weighed and an examination is done. Then the animals are put in their kennels to let the sedation take effect. From a practical perspective, this relaxes the patient and makes it safer for your staff to handle them, thereby minimizing risk associated with animal-to-human bites and scratches. Our key recommendation is to do curbside check-in. Since all parking lots are configured differently, there are 2 variations on this theme. The ideal scenario is to allow cars to freely drive in a circle into your parking lot and out of your parking lot. The owners never actually park, but instead an admin person meets them curbside with a tablet, uses HQ's e-lobby to check in the animal. Once they are checked in, the technician brings them inside to be weighed with the scale in the lobby and receive a sedation pre-medication. An alternative to this flow, if your parking lot does not allow circular drive-through, is to have clients park in a parking spot and to text to your HQ phone number to let you know that they are there. Here's an example of what the ASPCA Spay-Neuter Alliance has for their parking spots. Once the client texts, you can text back and ask the pertinent questions for check-in, or an admin person can go curbside and ask those questions with a tablet. Although we've been chatting generally about spay-neuter check-in, all these concepts should also be applied to high-volume vaccine clinics and wellness clinics. We strongly prefer drive-through vaccine clinics to vaccine clinics where patients get out of the car. Using the vehicle as a container is a smart way to reduce risks for your clinic. By eliminating multiple stacking triggers for dogs, it reduces their stress level and in turn increases safety for your staff. We consider curbside check-in to be a key fear-free tactic. The tools that you will use in ClinicHQ to accomplish a 2-minute check-in include 1, a confirmation email and appointment reminders that instruct the client on exactly what to do when they get to your parking lot. These instructions would also include fasting instructions for the pet. 2, email consent forms that the client signs ahead of time. If they don't sign ahead of time, they can sign curbside on a tablet just using their finger. 3, e-payment links that can be used in combination with deposits. This allows everyone to pay for their services ahead of time. 4. Service selection when making an appointment online and internally. 5. Pre-printing cage cards and baggie insert templates, along with handwritten, pre-filled dog neck collars and masking tapes for cats. This creates a packet of information for each pet. 5. Using eLobby for check-in. 6. Using patient flow to enter weight and the pre-surgical sedation drugs. We hope these strategies and tactics resonate with you. As you take this course, you will learn how to implement this flow. We'll show you how to pre-do everything. For now, we just wanted to introduce the concept and explain a little bit about why HQ is laid out in the way that it is.